guys know who these people are? Yes, no, maybe so. Okay, so these are the Planned Parenthood protesters who stand outside of Planned Parenthood on a regular and daily basis. They basically are for the defunding of Planned Parenthood, which basically means that they're against women's rights. And hi, my name is Biliana Informative, and today I'm going to scrutinize the funding of Planned Parenthood. So a girl I named Chinoa from Los Angeles, California, found out about the Affordable Care Act, also known as the ACA, while volunteering at Planned Parenthood, and she was so excited because it meant she could have health coverage again. If Planned Parenthood were to get defunded, she would have never been able to receive the medical attention that she needs. The Affordable Care Act is the greatest advance in a women's health generation, and according to Upper Hudson Planned Parenthood, the ACA requires that health plans cover important preventative services for enrollees without any copays. These services include birth control, breast cancer and cervical cancer screenings, and annual well woman exams that includes a vital signs check, which include blood pressure check, temperature check, height check, weight check, body mass index check, and nutrition for the patients, which will inform the female patients on their health status and intervention and expected goal in management, which they wouldn't be able to receive based on their inability to access health coverage. And then I have a video for you.
Here's a picture of me. This was right before my double mastectomy. And this is me a week later with my husband. My husband and I have been in the clothing business for over 25 years. As a business owner, your business depends on the market. What you make basically determines your access to healthcare and whether or not you can afford it or not. My insurance had lapsed and I felt a lump in my armpit. I called Planned Parenthood and made that appointment the following day, and when I went in, I met with a nurse practitioner, and she found the lump in my right breast. We both knew something was not right. She literally grabbed my hand and just held it. She let me have a moment to just cry. She set the tone for what I was going to do next. She quickly got me a mammogram, and then after that, an ultrasound, and a week later, I got diagnosed with stage 3 breast cancer. Here's a picture of me and my family on my last day of radiation. It's interesting when you go through something like this, how you find yourself being an example to your daughters. Planned Parenthood played a role for me, like it always has throughout my life. If somebody doesn't understand what they do, then I tell my story. If they're defunded, a lot of people will lose their lives. I'm a breast cancer survivor, and I stand with Planned Parenthood.
Okay, so that's a short little video on why Planned Parenthood is vital to the health of women and to us as a community. Since the policy went into effect, over 55 million women gained guaranteed coverage of these additional preventative benefits without cost sharing. This shift in access saves women an average of about $269 annually. A story like this isn't as rare as we think, and it could easily happen to anyone we know who doesn't meet the financial requirements for health insurance. This is where Planned Parenthood comes to play. Why would you guys listen to me? Well, I can say that I've done extensive research on this topic, not only for this class, but for multiple classes that I've taken in the past, whether it be a research essay, a debate, a persuasive essay, or even now as an informative speech. I've been so consistent with this topic because it's something that I strongly believe in. Now, I know most of you guys are probably thinking, why should we listen to her? This doesn't really apply to me. Well, let me ask you guys something. Do any of you guys have a mom, sister, grandma, aunt, niece, or all of the above? If you answered yes to any of these questions, then this speech does indeed apply to you. Today I'll be discussing the importance of the funding of Planned Parenthood and why it is vital to the health of men and women and the rights of women. In the event that Planned Parenthood were to get defunded, many lives of women would be heavily impacted. Why are Planned Parenthood centers so important? According to Planned Parenthood's main website, since Planned Parenthood is the country's driving conceptive medicinal services supplier and promoter, its centers focus on giving steady regenerative human services to 2.4 million individuals in a year. An expected 1 out of 5 women use Planned Parenthood and depend on their centers for consideration in her lifetime. The impact of defending Planned Parenthood centers is extremely great, and extreme government officials in Congress are undermining to acquaint enactment with defund Planned Parenthood. This incorrectly named exertion would authorize remorseless laws to block a great number of patients who rely upon Planned Parenthood centers and other general social insurance programs from getting to mind at Planned Parenthood centers. These government officials' definitive objective is to close down Planned Parenthoods across the nation, and in the event that this occurs, Planned Parenthood patients would lose their health coverage and most of them would have nowhere else to turn. Why is Planned Parenthood so beneficial to us as a society? Planned Parenthood provides health care to primarily low-income and underserved communities. Here's the statistics for you guys. Families USA, the voice for healthcare consumers, stated that in 2013, 78% of Planned Parenthood patients had incomes at or below 150% of the federal poverty level, which is $36,375 a year for a family of four. What's more is the greater part of Planned Parenthood centers are in rural, underserved communities. These are areas where there are insufficient suppliers to sufficiently serve this area's needs, and where lower income buyers regularly battle to discover a health insurance provider they can manage. In these areas, Planned Parenthood is on the fronts, guaranteeing that patients have equal opportunity. This affects us as a community because although the people in these areas may have a lower financial status than us, they still deserve to receive health care and deserve to be treated in their time of need. My next point is that Planned Parenthood assumes an essential job in handling well-being differences. That meaning that women of color are also affected by the defunding of Planned Parenthood. In 2013, 22% of patients served by Planned Parenthood were Latina and 14% were African American. Two gatherings that experienced the ill effects of different incongruities identified with rectum and cervical disease, aka cancer. For instance, Latinas and African American women are significantly more prone to pass away from cervical cancer than any other race. Guaranteeing that women of color approach the preventative screenings that can identify malignant growth and different conditions early is basic to diminishing these incongruities. As a believed wellspring of preventative consideration for colored women, Planned Parenthood assumes a key job in improving access to this consideration. Women of color in the United States as of now have less access to quality social insurance because of the crossing points of auxiliary prejudice, imbalance, sexism, classism, xenophobia, and other fundamental boundaries. The information I just enlightened you guys with leads up to my conclusion. In conclusion, we can't enable this organization to run over verifiably underestimated communities who may have now be attempting to make a decent living. Basically saying that the funding of Planned Parenthood would greatly affect us as a community, and you guys should really consider what the consequences of this may be.
So, Abe, some thoughts?
Honestly, I didn't know much about the topic. I think the video helped them, like, me see, like, better what the Planned Parenthood is about, putting the face behind the behavior. It was a good story. There was a lot of facts that I really couldn't absorb, but I know it was important stuff. Other than that, I think it was cool.
All right. Yeah, I think your video clip might have worked better as the attention device so that we know, we've got some way to relate to this. The picture of the people protesting Planned Parenthood doesn't really say much about the speech. unless you're turning it into a persuasive speech, which sometimes it really sounds like that's where you're headed with the presentation. I do think there's a problem because you conflate Planned Parenthood with the Affordable Care Act in a couple of spots, and though they are completely separate entities, and the notion that Planned Parenthood is covering 55 million people a year, that's obviously not it. Over a lifetime, maybe. You had this couple of numbers that were kind of confusing. You know, I got 55 million and then I got 2.4 million. I'm going, wait a second, that's a big difference. Planned Parenthood is a part of the system, and you've identified a lot of the things that they do, and I think that that's important. I think what you need to do is emphasize the things that they do that are especially unique. For example, women's health care, and particularly in places where it's not readily available. So you had this one section where you were talking about how Planned Parenthood centers are located in places where there isn't other health care. That's what I needed to hear more information about. I think I needed to see that, Planned Parenthood is the alternative for people in some of these areas. Now, the services that they provide, some of them are not listed here. Some of them are the woman that you show in the video, it makes it sound like she got all of her care through Planned Parenthood. She just got diagnosed through Planned Parenthood, and so that's part of the process. And that's kind of what you're trying to emphasize, that Planned Parenthood is part of the process. They are not the medical system itself, but they are part of a process, and they're an important part of the process, and you need to kind of show what they do that is not available other places. And that's the thing that I think was maybe the most problematic about the speech. There's a lot of information in the presentation, but I did not think it was very clearly organized. I felt like I was constantly jumping from one subject to another. Now, internally, you did have some signposts, and you said the next thing that I'm going to be talking about, but I had no idea what was distinct about the next thing that you were talking about from the previous thing that you were talking about. It all sounded like it was the same kind of thing that you were presenting. And like I said, you're conflating the description of what Planned Parenthood does and the services it provides with an argument about whether or not it should be funded and whether or not there are objections to Planned Parenthood that are justified or unjustified. And I think those are two different objectives, and you're kind of putting them together in the one place, and I think that's a little bit problematic. The video clip, like I said, I think it does connect with us emotionally because it gives us an example that we can relate to. Here's an important example of somebody who benefited from having access to Planned Parenthood in discovering that they had a problem, especially when they had a lapse in their coverage, and that appears to be when this woman got that diagnosis. So that's pretty helpful. It does raise a couple of questions. If she had a lapse in coverage, how did she manage to get these services later on? I'm not sure what's going on there. It'd be one of those things that would be maybe intriguing to hear about in another context. But like I said, the images, they don't do much to add to our understanding. There's a little bit of interest that's created by the video. The first thing seems like it has nothing to do with the main focus, what's supposed to be the main focus of your speech. And so I think you missed something like that. At the end of the speech, it sounds a little bit like you just kind of ran out of things to talk about, and you're petering out, and you should be hitting the high point and going back and even though I didn't think it was very clearly organized, there might be an organizational structure here. This would be a good place to rescue it at the conclusion of the speech with a kind of a recap of what we've talked about. So that we know that Planned Parenthood is under assault from financing. We know that it provides these critical services that are not provided elsewhere, and then we know that it's especially important to people in poverty or women of color. And suddenly it all makes a little bit more sense when you've got that last structural thing, and I can go back and say, okay, it does make a little bit more sense now. So it's just, I think you need to get that into the speech in a couple of places, and it's not there as clearly as it should be. All right, thank you.